I'm reporting that we have now one confirmed case of the Omicron variant in Alberta. This case has been confirmed in a returning traveller from Nigeria and the Netherlands. The individual tested positive while asymptomatic, and I can confirm that this individual has not left quarantine since their arrival from international travel. We have notified the individual and their household, and all necessary measures are in place to prevent transmission. I don't want Albertans to be alarmed. As I mentioned yesterday, we anticipated the arrival of this variant in the province eventually, based on what we have seen with previous strains of COVID-19. We are well prepared for this eventuality and have the necessary tools in place to monitor this case and any potential spread of the variant. As I have mentioned, our goal is to delay the spread of Omicron while we learn more about it. At this time, this is the only confirmed case of Omicron in the province. It's my understanding that the risk assessment is really based on the fact that this particular virus has a higher number of mutations in significant locations of the virus than we've seen prior, and so there is that possibility, there's that question about what that might mean for vaccine protection, again, how it might interact with people who've previously been infected with a different variant. So there are a lot of questions. I personally think that one of the main reasons why something, a new virus that has a lot of mutations, that early indications are that it may be more transmissible than Delta. Again, there's lots of questions about that, but it's a possibility. Anything that can spread more widely is clearly a concern, particularly in countries where vaccine coverage is low. And while we need to watch very closely to determine whether or not this virus behaves differently against vaccines, certainly there are many, many countries around the world where they have not had either the supply or the ability to expand coverage. And so globally, as long as there are countries where the virus could transmit widely, if it enters those countries, we are all at risk. And so part of this risk, I think, is about vaccine equity around the world. Part of the risk is about some of those unknowns, and until we know more about the virus as we are learning about it, I think it's appropriate to have that high level of caution. But the reason I want to reassure Albertans in particular, I do believe that based on everything we've seen prior, that vaccines are likely to provide still some protection against severe outcomes. And I believe we have a very good infrastructure for being able to detect this in its early days and slow its spread. We know that there are oral antivirals being developed, so medications that can help mitigate the risk of severe outcomes. We have the ability to offer vaccines to younger groups right now. There's lots of reasons to be hopeful. And so I think it's important that we're cautious, but that we also not see this as a reset to ground zero.